Mrs. Contreras?
Here.
Mr. Rader?
Here.
Mrs. Sochinek?
Here.
Mr. Nielsen?
We'll have a pledge of allegiance, please.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We'll ask for a moment of silence. Thank you very much. Ida, do we have any call to the public?
We do not.
Thank you. We'll move on to item 6, which is an action, correct?
Dr. Haid.
Dr. Haid, thank you. I wasn't sure who that was. So, Dr. Haid? Oh my goodness, I see. Congratulations.
My kindergarten teacher did that to me.
Uh,
Never learned her new name.
Yeah, I'm not good with names. I write them. So with that, we'll turn it over to you regarding employment and renewal of staff for 22-23.
Thank you, Madam President. What we would like to do this morning, this afternoon, it still feels like morning. This afternoon, we have 3 sections underneath this, so we can take a look at it by A, B, and C. So A is simply the employment and renewal of staff for fiscal year 22-23. So they're currently employed by the district, and we're looking for action from the board this evening to renew their contracts. There were some employees that have certification issues, and if their plans were not in place to make sure that they go forward, then we're still working with them. So you'll see this again for the next couple meetings, which is standard fare, that we have talked to those employees already, and we look forward to the board passing this so that we can issue contracts on March 1st.
Is there any questions on A? Hearing none, we'll ask you to proceed.
Madam President, I don't have any questions. I do want to note that I will be recusing myself from this item.
Okay, thank you for doing that. Let the record show. We'll move on to item B.
Madam President, do you want to do a motion for each one? I think since they're significantly different.
So with that, I'll request a motion.
This is Amy, and I move that we approve employment and issuance of contracts for certified staff, psychologists, registered nurses, social workers, and professional staff for the 22-23 school year.
I have a motion. Do I have a second?
And I'll second that.
Thank you. All in favor?
Aye.
Aye.
Is there any opposed? Hearing none, motion. And 1 abstain, thank you. And hearing 1 abstain and the rest ayes, motion will pass as noted.
Thank you, Madam President. Letter B is the contract signing incentive. This is something that the board has approved for at least the last decade. It helps us with recruitment and retention so that employees are encouraged to sign within 5 business days of receiving their contract. This is an annual budgeted expense that Mr. French and I have already discussed, and so there's no change to current practice or budgetary planning. So we're asking you to approve the continuation of the $450 signing incentive for employees who sign their contracts within 5 business days.
Thank you. Is there questions on item B? Yes, sir.
Thank you. Just a quick question. I don't know if it's for you or Dr. French, but and you've probably explained this to me every year, but how do we arrive at the $450 amount?
So there's, Mr. Rader, members of the board, so there's actually been a standing amount of money. At one time, we took $180,000 and it was like a jackpot. So everybody that put in, they could have gotten at least $450, but up to something larger to extend it. But we've had so many people return that we set it at 450, which is within the allocation we've budgeted tightly in the last 2 years to expend the same amount of money. We just took the Vegas part out, so.
Any more questions? Hearing none, I'll ask for a motion on item B.
I'll move the governing board approve a $450 contract signing initiative for employees who sign their contracts within 5 business days.
I'm confirming that's 450, correct?
Mhm.
Thank you. I have a motion. Is there a second?
I'll
I'll second that. Sorry.
Thank you. With that, I'll have a roll call. All in favor?
Aye.
Is there any opposed? Hearing none, motion will pass. We're going back to you on item C.
Madam President, item C is the duplicate of A, except this is for the employment and renewal of support staff. We will send out wage statements the first week in May. We do that only because some of the support staff employees are seasonal, and it gives them an opportunity to discuss with their family whether they're going to return after the summer break. And this, in the past, has given us the opportunity to make sure that we can fill positions for the opening of the school. So C, again, is just a repeat, and administration is asking you to approve employment and renewal of support staff for the 22-23 school year.
Thank you. Is there questions on item C? Hearing no questions, I'll need a motion, please.
I move that the governing board consider the recommendations for the employment and issuance of the support staff wage statements for the 2022-23 school year.
Thank you. I'll need a second.
I'll second.
Thank you so much. All in favor?
Aye.
Any opposed? Hearing none, motion will pass. Looks like you're going to stay with us on the next item, which is
Madam-
employee work calendars.
Madam President, members of the board, this item came to you at the last meeting for discussion, employee work calendars for fiscal year 22-23. We're just asking for approval for the work calendars with the additions that we talked about last time. And as you had suggested, we went to the employees that had the additional holidays added to their work calendar, and they were most appreciative, and we do expect a high retention rate from our group again this year. So we're asking that you approve the work calendars for fiscal year 22-23.
Thank you. Is there questions on item 7? Hearing none, I'll have a motion to approve or disapprove item 7.
I move that the governing board approve staff work calendars for fiscal year 22-23.
Thank you. I'll need a second.
And I'll second that.
Thank you so much. Roll call, please. Oh, roll call, all in
Mrs. Ray?
favor?
Aye.
Okay. Aye.
Aye.
Any opposed? Hearing none, motion will pass. You're on a roll, so you're on to number 8, which is contract and wage statements.
Gonna swap computers, we're having technical difficulty with the Zoom.
No problem. So those of you that couldn't hear, I guess we're on technical difficulty. We're getting it corrected, and we'll continue here shortly.
What part is Lisa spooling or is Jim? Okay. So it's our broadcast, for the remote.
Okay.
We're okay, we're just.
Yeah, that's what I assumed. Thank you. So if you're online, hang on there. We're trying to get some stuff up so you can see it.
Water break?
I know. Mask down, drink. Nothing like last minute. I guess they could have waited a few more minutes, so we'll give them that.
Oh my God.
Yeah, I was just happy it took care of itself.
It's gonna be a long session.
I think there's a lot coming.
I try not to.
Let's talk about the kids.
I don't blame you.
What are you guys doing over there?
Kristen, again, we apologize, bear with us, we're trying to get this item working so you can be part of the see and show and tell and all of that.
What's happening on the YouTube channel right now? Just a lot of black, or does it drop?
We have that old please stand by logo.
Can they hear us?
Oh, poor people.
Mike?
Thank you.
What was that you said about the governor, Mr. French?
Or it could be like the Twilight Zone, remember that star effect?
Oh, Ron Sterling.
That's right.
Dating you.
We're getting feedback from multiple employees saying, I can hear, I can't see, I can see, I can't hear, I can't.
So again, if you're on the line, please bear with us.
They say they're seeing someone's Zoom getting set up, Jim.
We apologize for our technical difficulty. Okay, we think we have it working. If not, please notify someone. And
Item 8.
item 8, thank you, Dr. Freeman, contract and wage statement.
Okay, Madam President, members of the board, this had a quick change just a few minutes ago from what was up. We had some last-minute changes from our attorney to add in the AEL clause for next year. So the only thing, I actually put up the black line strike-throughs so you could see those tonight and should you choose to approve this item. It includes language that either the district is not funded or the new language or is not authorized under the aggregate expenditure limit. And so we have that taken care of. Hopefully that gets resolved, but those are the changes in the contract language. Wage statement language did not change.
Okay, thank you. Is there questions on item 8? Hearing none, all in favor?
Motion.
Oh, yes, I do. Thank you for pointing that out. I appreciate it. Technical difficult and speaking difficult.
I'll move the governing board approve contract and wage statement language for fiscal year 2022-2023.
I'll second.
Thank you so much. Now I'll take that roll call. All in favor?
Aye.
Any opposed? Hearing none, motion will pass. Thank you. Next, looks like we're going to turn it over to Catholic Charities Head Start for information. Thank you.
Thank you, President Reyes, members of the governing board, Dr. Freeman, Littleton community. This evening, I'm bringing before you the lease and operating agreement between Littleton and Catholic Charities for the additional 6 preschool classrooms. This agreement will secure approximately $1.9 million in contributions to the district, and it would allow Catholic Charities use of the facility for 15 years. This agreement has been reviewed by both parties' legal counsel, and we are recommending this evening the board ratify the lease and operating agreement. Be happy to answer any questions that you have.
Is there questions on 9?
Madam President, I don't have a question, just a statement that, this is a wonderful program, and I'm so glad that we and the leadership here at the district has taken steps to continue it and to further expand it for the use of our students and the district. And I just can't say enough good things about the staff and people working there.
Thank you. Any other comments or questions? Hearing none, I'll have a motion for item 9.
I will move the governing board ratify the Catholic Charities Agreement for the Head Start expansion at Littleton Elementary School.
Thank you. need
I'll
a-
second.
Thank you, Amy. All in favor?
Aye.
Any opposed? Hearing none, motion will pass. Thank you. We'll move on to number 10, employee benefits, sir.
Thank you, President Reyes, members of the governing board, Dr. Freeman, Littleton Community. This evening, we are looking at the district's recommendation for employee benefits for fiscal year 22-23. We are recommending the district increase. Oh, Jim, can you open up the attachment for me, please? Board, this is the typical form that we provide to you every year that shows the rates based on the plans that we offer. We are recommending the district increase the employee-only contribution of the high deductible, high premium plan to $5,879.64, and as well as a $300 contribution to the HSA plan. This would be an increase of just over $700 to the annual contribution. Administration is also recommending an increase to the traditional plan employer contribution to $6,179.64 to match the high deductible, high premium plan. The district would also like to structure the voluntary HSA match slightly different this year. This year, the district provided $300 guaranteed to an employee's HSA when they enrolled in the high deductible, high premium plan with a voluntary HSA match of $500. The district would like to split that $500 into two parts, a voluntary match and a contribution from the district once an employee reaches level 3 on participation in the district wellness program. The district would like to match $200 and would provide $300 once the employee obtains the wellness program level. This proposal has been provided to the LEAP committee for review, and they have approved the structure as is. For ancillary benefits, we're going to see a small increase in Delta Dental of $1.78 a month, and all other ancillary benefits have no increase this year. We are asking that the board approve the proposed rates as provided.
Okay. Is there questions?
Madam President.
Yes, sir.
Thank you. Mr. French, maybe you could, I know we went over this briefly at our last meeting as well, but so bottom line it a little bit for me. So the average employee, about how much is their premiums going up on a monthly basis, or how much is their contribution going up on a per pay period for employees?
Madam President, Member Rader, the employee-only amounts are being covered by the district.
Okay.
So the average employee that have no dependents is not going to see an increase in rates because we have historically a free option for an employee. The amount that the district is paying is going up approximately $700 annually per employee.
Okay. No, thank you very much for that clarification.
I have questions. So on the $700, what percentage is that? If we break it down into a percentage, what percentage is that?
President Reyes, when we did our renewal with Valley Schools, they were looking at a 13% increase for Littleton.
And is that typical for Valley Schools for other districts similar to size and characteristics, or is that based on purely our own claims history?
Madam President, that is based on Littleton experience. That is one of the reasons why that we took, what we would like to do is break out that match amount and provide an employee $300 once they reach a certain level in our wellness program. It incentivizes them to participate in the wellness program, which we're hoping will bring our experience down or help alleviate some of the increase.
So hence the wellness program is being beefed up by whatever form you're doing that in order to hope that things are caught early to reduce claims.
Correct.
And in your, and in terms of family, I don't know, how many family units do you have here, do you know? Is
I
it
do have
more
that information.
families, just more employees?
Madam President, we have
total census and then the census of employees only.
We have number of employees is 466 and number of members is 652.
A little under 200.
So relatively small in terms of, but that's people that cover them, correct? That you know about?
Correct.
They pay for that.
And what's your percentage split of family? So employee pays what, 50 and you pay 50, or is it 60/40? What is that?
We put the same base amount into every staff person. If you select up, you pay up. There's
Right,
no-
but what percentage is that, give or take, on an average of your 3 plans?
Oh, yeah, we did multipliers. Do you have those?
Madam President, I don't have that information in front of me. I'd be happy to get that for
Yeah,
you.
maybe you can send it to us.
Spouse was 1.9, and family was 2.6, something along those lines. We do have that.
Okay. Yeah, that's fine. I'm just curious of the split for the family
And
piece.
child was like 1.6, I think child 1.6, spouse 1.9.
0.9, and the other
family
2.6?
2.6.
Okay.
It's in that neighborhood.
And one more question, who's tracking your wellness? Because are you doing it by points or a point system?
Yeah, Madam President, we do have a point system. We have through Valley Schools, we have called Well Styles. It's through Virgin Pulse. It's an app that we have on our phone. We are able to assign points based on certain activities that we incentivize our employees to do, like a wellness checks are worth a certain amount of points.
You
Tracking the-
self-administer this, or do I go in and log in and track, and it's kind of a self-reporting, some of it?
Procured service.
Okay. He's answering, I'm sorry, I don't know
No,
if
that's
you can
okay.
hear. I apologize, he's answering, so it doesn't. All right, that's all I have, I appreciate your comments. And what's our average rate increase? It normally 13, is that right in the ballpark for us?
No, Madam President, that is higher than typical. We typically run a lot better than any other member district in the trust. We are catching up to average.
Our per member per month is still below the trust average.
Okay,
We just had a couple really good years followed by this one.
but, gotcha. How many people are in the trust? How many schools?
Madam President, I don't have that information
okay.
off the top of my head.
Thank you.
The largest, it's like
Yeah, I know they're very large.
30,000 members.
Yeah, I've read about them in the paper, thank you. Okay, so with that, I will take any more questions on item 10. If not, I will have a motion to approve or disapprove item 10.
I move that we approve the employee medical, dental, and ancillary benefits for fiscal year 2022-2023.
Thank you. I'll need a second.
I'll second that.
Thank you so much. All in favor?
Aye.
Any opposed? Hearing none, motion will pass. Thank you. Looks like you have the compensation continuation as well.
Yes, Madam President, you're stuck with me for another presentation. Members of the Governing Board, Dr. Freeman, Littleton Community, at the June 22nd, 2021 Governing Board meeting, approval was given to the district to provide staff a one-time stipend that equaled 1.25% of their base pay. We did this through the ESSER grant, which was the COVID relief money that we received from the federal government. This was done in an effort to keep a competitive wage in the workplace. It cost the district approximately $385,000. After reviewing this year's budget and the estimates of inflation funding that will be added to the base support level for next year, the district would like to continue the 1.25 stipend by moving it out of the ESSER fund and into the employee's funding source or the maintenance and operations budget. So we would recommend that we are requesting that the board approve that this evening.
All right, is there questions on 11? Yes, sir.
Yeah, thank you, Madam President. Mr. French, so the 1.25 stipend, I mean, is this the total, you're moving it over on the assumption on the upcoming budget or on the existing budget?
Madam President, Member Rader, so the 1.25, we've reviewed this year's budget and what we believe we'll be able to carry forward into next fiscal year. We will be able to absorb this and not have any impact to the operational budget. What we were looking at last year is we had talked to the board a little bit about, we had ultimately ultimately provided employees a 3% raise. We did 1.75 as a permanent raise and 1.25 as a one-time raise, dependent on, you know, the outcomes financially of the district this year. We did increase enrollment where we were seeing some of those indicators that would allow us to absorb that 1.25% and allowed employees to see it on their contract when Dr. Haid issues those March 1st.
Okay.
Dr. Freeman?
Madam President, Member Rader, the way the inflation agreement is set up, it's inflation or 2%, whichever is less. And right now, inflation is running well beyond 2%. The governor put 2% in his budget. So we think that's the floor for the adjustment to the base factor. With the 1.25 and insurance and other things like that, we think there'll still be money left over in addition in the base factor. Of course, we'd love to see the legislature do more than 2%, but they've been a little stingy of late. You know, of course, having the AEL out of the way certainly helps. But we think, we are planning to bring additional compensation back to the board in May or June when we know what the legislature is doing. So this is not by any means the whole compensation effort, but it allows human resources to put contracts forward that match this year, so nobody sees on their contract offer what looks like their wage going down.
No, thank you for that explanation. I think my initial fear was that this was the total compensation that we were talking about for the upcoming year. So the additional explanation that it's essentially matching with what we've been doing thus far is very helpful. Thank you.
I have one quick question. So when you're moving the stipend, you're moving it to the employee's base pay. When you move it to the base pay, does it carry forward, or is it the employee's base pay? So if I'm calling you, go, what's Kathy Reyes's base pay? Are you telling me that's base pay with the stipend in it? In other words, how do you keep track of when you're calculating true base pay? Because do you move your salary ranges from different categories to account for this base, or is it treated separately?
So President Reyes, what we do typically on a pay stub is have an employee's base rate and then include any stipends underneath that they're eligible for. Base pay is what receives raises on top of it. We don't receive raises on stipends, so we'd like to include this in their base so they can potentially receive raises on that when legislature's out of session, when we bring it back to you, additional compensation later on.
So this does increase base.
Correct.
And so on that 1.25, that's base. And then on top of that, if you give 3, 4, whatever you're giving, that's base. So then do you move your salary scale? Because if it's now base, my salary scale has to be moved, right? So you have minimum, midpoint, and max. So is my salary scale moved?
So President Reyes, Dr. Haid had brought those to the board. We do look at low point and high point in the salary schedules and make adjustments based on inflation and raise amounts.
Madam President, that actually is an item for the next board meeting to talk about salary schedules, and you're exactly right. With this going, there are a few employees that will get to the max and will need to raise that,
And
which
you'll
we've
just
done
continually
traditionally.
keep raising it based on whatever the world looks like and where inflation goes and whatever you need to do?
Yes, ma'am.
Okay, understand. Thank you for the clarity.
Of course.
Any more questions on item 11? Hearing none, I'll have a motion, please.
I move that the governing board approve the district to move the one-time ESSER stipend approved for the fiscal 21-22 into the employee's base pay.
I'll need a second.
I'll second.
Thank you. All in favor?
Aye.
Any opposed? Hearing none, motion will pass. Thank you. And it looks like you have one more, sir.
One left. President Reyes, members of the governing board, this is a discussion item only. I think at this point we all know that the Senate passed the aggregate expenditure limit on Monday. So there will be no cuts to the 21-22 school year. If anybody watched the hearing, there was some mention of the 22-23 school year, and we are expecting another fight again for 22-23. We would just like to provide a special thanks to Senator Contreras and Representatives Espinoza and Sierra for helping get these votes and their steadfast support to our public schools. We are hoping that the legislature takes a look at this and provides a referendum out to the voters to take care of aggregate expenditure limit. If for some reason they don't, there may be an initiative from the people. So I would be happy to answer any questions that you might have, but that was really the item. This item was on there just in case they hadn't passed it yet, and we're having another conversation, but luckily it's an easier conversation for me to have tonight.
Thank you. And on behalf of all the board, please let them know that we don't always get a chance to talk to them personally, but please let them know we greatly appreciate their efforts on behalf of public education. With that, Dr. Freeman, it looks like you're up talking about a mitigation plan.
Thank you, Madam President, members of the board. I want to touch briefly on the resource planning calendar because we made some adjustments knowing that AEL considerations could be dropped. Of course, you know, staff had been working on that and preparing for the meeting in the event the legislature didn't act. Next month, we'll have CAFR results and continued monitoring of the legislature, but you'll be able to see that in the work happening by the staff. If you go to the second page, thanks. We'll start AASA testing. That used to be AZM2 or AZ Merit or AIMS or ASAP, or depending on which year and what version you're on. But that will continue this year, even though it's been kind of a roller coaster year. We're not 100% sure of the kind of conclusions people can draw from that test, but we need to get moving forward, have our kids get some experience with it, so hopefully that levels out and we will be able to look at growth over years. We are moving forward with school choice, and you saw the countdown and developing the parent-student handbook and getting feedback on that. We'll be moving into open enrollment and those kind of things now that we've adopted the schedules for what employees are going to pay if they want to add dependents. There is some other work needs to be done in preparing for next year. We have a couple other initiatives, a teacher preparation program that we'd like to develop to help with the staff shortage. And we want to continue working on a instructional services plan, which we'll talk about at a future meeting and get feedback from the board. That's an instructional services RFP at the April meeting. We'll continue to work that based on board feedback and figure out at what time that might be appropriate to release or not to release, depending on guidance from the board. The usual things, the classroom site fund plan, finalizing the student parent handbook, and then in May and June, depending on the action taken by the legislature, begin to finalize those compensation pieces when we know actually what the legislature is going to do for increases to the base or other programs. The governor has a lot of ideas for some special funding. Most of them are incentivizing test scores and people leaving public schools, so we're actively working to oppose some voucher expenditures and policies related to student letter grades and test scores and those kind of things down in the legislature. We certainly believe if we're last or near last in the country in state and local effort to education funding and per pupil amount in education funding, we should be prioritizing shoring that up first. All of that going on this spring, and you'll see the 301 classroom site plan components probably revised this year and brought back. Of course, we always survey the teachers on that plan. So a lot of work still to do this spring. In addition, we will have on April 26th groundbreaking at Alamar. Madam President, we need to decide if we want to do that at 4 or 5 or 6 o'clock or that kind of thing and get that out to members, so maybe we can get an idea what people's feelings are about that, and anything people would like to have as part of a board retreat for the remainder of that afternoon, early evening, so we can get planning on that.
Can we just take a minute and ask if it's 4, 5, or 6, just to
You
get a feel?
you may discuss the calendar and resource planning at your leisure, as long as we don't try to take any action.
No, I'm
you're
not taking
fine.
action, I'm just trying to get a feel. So
Yep.
while we move on, is there a preference from April 26th, perhaps a 4, 5, or 6?
I can say for me, there's no way I can be here at 4 because I'm on contract until 4.
Okay, so 5 or 6, or what we're?
5 or 6 is fine, it's just I couldn't make 4.
No, that's why I'm asking. Mr.
Yeah,
Nielsen?
5 o'clock would be great.
All right, so it sounds like there's no opposition to 5, so if that works in your calendar, you can let us know.
Great.
Thanks. All right, sorry to interrupt you.
No, not a problem at all. I'm just doing a quick summary of this document because we made some changes and told the board if we updated it, we'd bring it back. I'm ready to move on to mitigation plan if members of the board are ready. Madam President?
Is there any more questions or suggestions? Hearing, yes.
Just ask a quick question. I know, last year, our summer school program, I thought, was phenomenally successful, and I know the governor's, you mentioned the governor had some initiatives, and I know one of them is a learning loss summer school style initiative. Is there any additional information on our plans for summer school and/or the governor's program?
Thank you, Mr. Rader, President Reyes. We're moving forward with planning for a summer school. We have 2 issues that influence our planning. One is availability of staff to help implement the program, and the other is availability of students to attend the program. So we're going to be soliciting engagement and enrollment of both, and whatever the maximum number and the preferred student-teacher ratio we get will become the cap. Staff has made a couple calls to the 9th floor about the governor's summer school plan, and details are still pending. We're a little surprised they want to run a summer school, having never done it before, when most districts do every summer. So they have not released details to school districts on how they plan to do that. So I don't know if that'll be, in small groups of 10 in people's living room or actually involve school districts, or we don't know. But we're moving ahead to run a program at the greatest possible capacity based on participation, and using ESSER money to make sure that we can do that.
Thank you.
Mm-hmm.
Hearing no questions, we'll let you move on, please, to the mitigation.
All right, Madam President, members of the board. So tonight, the management team does want to make some recommendations, not to change the mitigation plan, but to change the levels of mitigation. And we have a lot of information attached. Some of it members have already seen, and some of it is pertinent to members of the community who want to look over the information we're considering. So we have the graphs that board members see typically updated each week. And there is, if you scroll down, you can see that the county is exhibiting the same kind of spike and decrease in illnesses. The graph below that is overlay of Littleton's demographics in the counties. The spike on the right is a nice illustration of Littleton's metrics versus the counties. So Littleton's is the one that's up there above 3,200, and the counties is the one that's up there above 2,000. So our school district typically has run higher than the county all through the corona outbreak. You can see that it follows some similar patterns. The other lines that are overlaid are the trend lines, and they haven't turned down yet. If you look at the multi-parameter trends on the other graphs, you can see that they're turning down because they're shorter. This is the metrics since inception, and you can see the spike that we had last January was at 1,202.8. We were up over 3,200 this time. For our numbers, we're down now past where we were in the last spike. And so the rate of decrease is quite promising. Jim, if you'd go back up a couple graphs up to the Littleton data there, if you see the one on the left, what you see is Littleton's data for illnesses is the one that shoots way up, illnesses per 100,000. The double line graph lower is the percent positivity. So you can see when that peaked, it dropped a little bit, and then it started to drop a lot again, and I'll talk a little bit more about that trend relative to the county when we get to recommendations. So if we scroll down a little further, what we have here is the data for the United States on the different types of variants of Omicron. And the orange you see on the left is the old Delta variant, and where the purple comes in is the Omicron. And then you see the dark purple bar that starts out pretty small when there's a lot of orange, gets a little bigger, and then becomes the dominant strain. That is the BA.1.1 variant of Omicron. There's three types of variants. They're calling them sub-variants. So this is spreading at a super high rate, also seems to be declining at a super high rate. So people are optimistic about that variant moving to endemic status, and so being treated more like the cold and the flu as we move forward. You'll see states and different levels of government and business starting to strike out on their own, making their own decisions about masks and mitigation now. If we scroll down a little further, the big concern right now is this is data on hospitalization of children and adolescents. And the thing that's concerning is the solid line on top is 0 to 4 years. The dotted line is 5 to 11, and the dashed line is 12 to 17. And part of the problem we're seeing, even though a lot of Omicron isn't severe, it does still result in hospitalization, especially people with little lungs. And so that rate shot up very rapidly. That's because the spread is so rapid, that if this had been one of the other variants, you might have seen the same increase, but it would have been spread out over more days because it didn't spread as much. The bad news is that younger group is being more infected because it's so much more infectious. The good news is it started to drop. And I guess that's their kind of a sign of caution for people who think we should just stop worrying about Omicron and get on with our lives, that it still is impacting certain subgroups of people at a serious level. If we scroll down a little further, you can see what some of the attachments are. And I think what I'd like to do is expectations for return, governing board. That's the colorized one, Sue. That's right. Okay. So this is going to be, it's a kind of a long wrapped out graph, and what I'd like to do is give you guys a summary of the changes. So let me just give you all
Thank
those.
you.
So I'm going to go in alphabetical order down the left column and talk to you about some of the things that we think should be changes. So what you see is the level of mitigation we're at is in bold print with a bold border. And the changes that I want to talk to you about are in the first square. We had currently had access to curricular materials on yellow. We want to move that to green. What we're seeing is that Omicron's not really passed by glue and tape and magic markers and Kleenex boxes. If it's in the air because somebody is in the air sharing the virus, it's in the air and you're going to get the virus whether you share crayons or not. And if it's not in the air, the crayons aren't going to give it to you. So we had restricted sharing of instructional materials and those kind of things at tables And we don't think that's really a threat to kids or to wellness anymore. We'd like to move that to green. The same thing with assessment is that giving people the option to assess in different modalities without trying to keep them online. Move that to green because we don't think with this virus and the way it spreads that that's going to be a problem. With athletics, we'd like to move that to yellow. We have not had any sports, but what we'd like to do is make fourth quarter sports a condition that it's just outdoor sports to add an extra layer of safety, but to restart the sports program with some outdoor sports. People are really looking forward to that. In the past, we had moved sports indoors in fourth quarter because it's May and June, it's going to get hot, but we think right now nobody's going to care. And we'll try to get an early start on the season after spring break and not be out there at the end of May. Field trips, we think that we can move forward. Of course, we still are doing virtual field trips, but only overnights would be allowed if there's a lot of strongly medicated venues. We still are planning for the kids to go to Washington, D.C. or in spring break, but that's a pretty highly regulated trip and not a very big group, and they're all family volunteers, so nobody's compelled to go, and they've all paid extra to be able to attend that trip. We think masks probably should be required when people leave campus just as a precaution if they're going to go somewhere, and that's why it's still yellow. Governing board meetings, we moved to yellow at this meeting, and it's kind of at the discretion of the board. We didn't move that to green because we're not moving everything to green yet. Essentially, if we moved it to green, it would mean that you could put all the chairs back, fill the place to standing room only, and we think we're not quite there. I'll explain to you when we talk about masking how those two things fit together. For internal meetings and outside consultants, we think we can start bringing those people back in and just showing reasonable precautions of some distance, good hygiene, and those kind of things. We want, whenever we invite anybody from the outside inside, working with staff to make sure that they're vaccinated. The same thing would be true for volunteers. So let me talk about masks a little bit. What we've done is come up with a phase back, phase out program. There's two metrics that we're looking at, and that's the masking mitigation guide in the middle of your paper. So we're looking at the percent of illness, which is what we see kids' absenteeism. What we're running right now is 8 to 9%. It has varied by grade level, by school, but we've moved back into single digits for students being out with illness. Now, the positivity rate for Littleton at the last metric, the one last reported last Thursday, was 23%. But Maricopa County was 17. And what I put at the positivity trend at the bottom was when Littleton was 47, Maricopa County was 33. The next report we moved to 32. When we were 32, Maricopa County was 25. The next report we moved to 23. When we were 23, Maricopa County was 17. So this Thursday, we anticipate moving down even further, is that we're just following behind that trend for Maricopa County, which would put us at strongly encouraged for masking. Now, the other thing that we anticipated the board asking is what are other districts around us doing? There are several that have optional mask. I think Chandler has had optional masks the whole time. You might say, well, that's East Valley, not West Valley. Liberty and Buckeye and Dysart have had optional masks. Avondale has switched to highly encouraged. Litchfield has them required, but anybody can opt out. Cartwright is requiring, but considering lifting. They're watching the metrics like we are. Alhambra, Pendergast, Phoenix Union, and Tolleson Elementary still are all required. What we're thinking is when we get our metrics in on Thursday and we look at the student absenteeism, we can tell you what the mask requirements for next week will be following along this chart. If our metrics come in, if our absenteeism stays below 10 and our metrics come in the mid-teens, that we can move to strongly encouraging masking. Now, there is one more attachment. Jim, I'm going to ask you to open one other one kind of in the middle of this one because we're talking about masking. And that is the not the isolation flow chart, the Maricopa County return to school. And if you could zoom in on this a little bit. So these are the quarantine and isolation guidelines. And what we've been able to do right now is we're in the all green row because we require masks. When you require masks, it makes your isolation and quarantine much simpler. Essentially, you can be on a 5x5 plan. As soon as people are not symptomatic, they can return with masks. If we lifted the mask requirement, then we need to check and see if there's a positive case, if the person with the case was wearing a mask, because it's less likely they're going to spread Omicron, and if the people who were exposed were wearing a mask. And then you see what happens is you work your way down the chart for the number of days and length of quarantine, depending on the masking. And there's also vaccination status when you look at the return to school or return to work flow chart. So there's a lot of things we need to ask and follow up. As soon as we loosen up our masking requirements, there's a potential that some students will move from a 5-day quarantine and isolation to a 10-day quarantine and isolation. There's also a chance people will keep their masks on and we'll be able to stay with 5+5. So that was provided in one of your updates, I think a month or so ago, and it's an attachment with the item if you want to review it for a little more scrutiny. I'm just giving you in broad strokes. Vaccination and masks change the length of isolation and quarantine. So if we go back to the chart then, what we're recommending is moving to yellow. And that means allowing us on a weekly basis to move from required to strongly encouraged or recommended if our metrics are improving. Not just willy-nilly at the discretion of politics or the most outspoken people, but when the numbers are dropping, kids' absenteeism has gone down and positivity has gone down. Let me finish all of the changes and then, Madam President, come back and ask people how they feel about. We had recess and playground usage. Once again, we don't see Omicron being spread by kids using recess and playground equipment. We want to keep volunteers who are registered with immunization so they're not bringing any kind of illness into the school environment. And then staff travel, we've moved to yellow. We think there's just a lot of places where there's enough mitigation in place that people are pretty safe. And I'm sure you're seeing the same thing I am if you're out and about. A lot of people not wearing masks in indoor places or where there's a lot of people. So I think some of the Omicron is burning through pretty quickly. I think, I heard a number, I can't remember it was today or yesterday, 70 or 80% of people have had, some exposure, some symptoms or something. And I was talking to somebody the other day, they said, I thought that was hay fever. Maybe I should have got tested. That in some cases, people are pretty cavalier. And in other cases, people are concerned that, you're killing their grandma. The whole range of very casual to very serious responses from people. But we think most of the staff are pretty responsible in going to meetings and those kind of things. So that would be okay, yellow. We're not quite ready to go to green yet on that. Those are just some of the changes that we think at this meeting. Again, we're convening in another 2 weeks. We'll review the data again. We think it will be helpful to morale both in the staff and in the community to have some of these things back without going full bore back to green. but trying to do a measured incremental retreat to what would be more normal and get there as the metrics allow. So this is the management team's proposal for your discussion. We're not actually talking about changing the plan, just changing the implementation levels. So we just want to hear from the board what they're comfortable or not comfortable with, so we can put that out to staff and let them know where we're at.
So at this point, I'll open it up for questions regarding any of the mitigation guide changes or suggested changes.
Madam President, I don't think I have any questions. I am very supportive of the plan that was presented. You know, I think it's important. I think the district has done a great job of letting the data dictate the measures that we've implemented in order to protect our students and ultimately to keep them in in-person learning, which was our goal all along. You know, I'm in favor of what has been presented, and in particular the recommendations regarding sports, which I think are very important to many of our students as a motivation of getting involved in an important part of their lives, as well as, you know, again, as the data reflects, having the flexibility to move the mask to a highly recommended status as well.
Thank you. Any other comments or questions?
I don't have any questions, just a comment again, piggyback off of what Mr. Rader stated. I think the district did a really good job of planning and really just being very clear on what the mitigation levels and changes are. So, you know, I would be in support of following the data and following the science with that.
Thank you. Amy?
I don't really have any questions about this at all. I agree with Mr. Rader and Ms. Contreras. I guess I lied. I do have a question. So I'm excited to see that we are opening up for registered volunteers to come in. Would they be following the same mask guidelines like the volunteers that are coming in? If the school or the classroom is wearing masks, then they would be? Or I guess that's my question. I didn't know exactly what our expectation for the volunteers would be.
Our idea was that we wanted to have, so when volunteers come in and register, we make sure they're not on the danger to children list. We actually do look at their backgrounds. We're also going to ask them for vaccinations, and we think that if people are appropriately vaccinated, the chance of them spreading disease is as low or lower than other people in the building. So they would be able to follow whatever all the same guidelines as other people in the building. What we tend to be seeing with people Omicron illnesses is the majority of them are pretty mild, and the amount of spread for people who are vaccinated is very mild. So we have staff who aren't vaccinated, fully vaccinated, who are there at work as long as they're not in isolation or quarantine or having to, we haven't had them have to wear masks. If we went to masks recommended and they were returning 5 days asymptomatic, they would be required to wear masks 5 days. So we might see some differentiation in people masking and not masking, because that'd be a condition of their 5-day return. So I don't think, even if we wanted to be, very fastidious about, making rules for volunteers, even being able to pay attention to enforce a different standard on different people walking around the building would be really hard. So our idea is, with that caveat, it would be the same.
Let me
Thank
just
you.
ask one clarity myself. So if I'm a volunteer, you will ask me if I'm vaccinated. Is that correct?
Yes. You actually are going to fill out an application to qualify as a volunteer.
But if I'm with someone who's not vaccinated, I'm sorry, I'm missing the point.
if I'm with someone.
So-
So we're not requiring staff to be vaccinated,
Right.
but we've hired them to work every day, and we compel the children to attend. Volunteers don't have to be here.
Interesting.
The staff and the kids
Okay.
do.
Yeah, I'm not sure
So-
my opinion runs parallel to that,
Yeah.
but it's just, that's my own opinion. I think if you're going to require volunteers to be vaccinated, I understand, maybe you say you have to wear a mask, I get that. But if you're not requiring staff to be vaccinated, but you're asking a volunteer to come in and be vaccinated,
We're not asking them to come in.
but I want to volunteer. I mean, I understand it's a volunteer, but I want to help my student, I want to help the district, but I have a different criteria than the staff itself.
Yes. Yeah, it's kind of a higher expectation, and because we don't have a lot of other background information on you other than you want to come help. So, yeah, we're not thrilled about it either. But imagine if we didn't have the requirement, somebody came in and spread Omicron all over the place, and some kid took it home and somebody's grandma died. Who would they be mad at?
But wouldn't that be the same for the teacher or anyone else that's not vaccinated?
They're compelled to work here. Some of them have medical reasons, some of them have religious reasons, some of them
And
have.
that's my point in volunteering. What if I have a religious exemption that I can't, so I could never
Yeah,
volunteer?
we haven't asked that. No, never is, never is just, never is a long time. Mitigation, we're hoping we can reduce,
No,
in the next, yeah, it's temporary. I think there's a difference between signing a one-year contract and being compelled to attend school from 6 to 16
Yeah.
and being on a temporary mitigation plan. I don't think they're exact equals, but I get it. I mean,
It just,
we grapple with this with staff and with everybody all the time.
yeah, no, I
So-
understand. Thank you
And
for
we've been
clarity.
kind of limping along without volunteers, where we'd love to get them back into the school.
That's why I
and
think they're
help,
so critical to just the survival of many things. So, but thank you, I appreciate the clarity. Is there any other questions, comments? No? And I'm also happy to see anything that's yellow move to green or red to yellow. It's nice, and I'm sure lots of individual staff, teachers, children, parents are all excited about whatever normal means anymore in the world we live in. So it's a good thing. So thank you for doing this. With it, this is possible action. So is there action presented, and is the board ready to make action on this?
We're not asking to change the mitigation plan, only
Okay.
the levels, from red to yellow to green.
Okay.
So we haven't made any substantive changes. Nothing that we report to the ADE or anything like that will change. We're just talking about the implementation of the plan.
And that doesn't require a board action?
No, ma'am.
Okay.
Otherwise, we'd have you guys voting like,
That's what I
Every
wanted to
two,
make
yeah.
sure. Thank you. I appreciate the clarity. All right. Hearing no more questions, at this point, we'll have a motion for adjournment.
I move that we adjourn at 7:03.
Thank you. Second.
I'll second that.
Thank you. All in favor?
Aye.
Hearing any opposed? Motion is adjourned at 7:03.